health. The most important thing is, listen to your body every day. If you're over 60 and those leg cramps keep coming back, especially at night, don't assume it's just a normal part of aging. Sometimes, it's your body's way of sounding the alarm that something far more serious could be happening, from cardiovascular disease to blood clots to nerve disorders. Today, I'll show you exactly when you need to see a doctor right away to protect your legs and even your life. In this video, I'll share with you 5 common causes that make older adults more likely to experience persistent cramps. The red flag, warning signs that mean you should see a doctor immediately. Simple at-home methods to help relieve and prevent cramps. If you or your loved ones are suffering from nighttime calf pain, watch until the end, because today's information could completely change the way you protect your leg health. If you find today's tips helpful, don't forget to click like on this video, so I'll know I'm on the right track. And be sure to subscribe and turn on notifications so you won't miss future videos, where I'll continue sharing practical, easy-to-apply health knowledge for people over 60. 1. Why older adults are more prone to prolonged muscle cramps. Many people think cramps are just the muscles tightening for a bit and then relaxing, but in reality, at our age, the underlying causes are often more complex. I want to share 5 common reasons why older adults are more likely to experience this, so we can understand them and know how to prevent it. 1. Electrolyte imbalance, fuel shortage for muscles. Our bodies function thanks to minerals like magnesium, potassium, and calcium. They're like the fuel that allows muscles to contract and relax smoothly. When these minerals are lacking, muscles become more excitable, and even a small trigger can cause them to contract painfully. As we age, nutrient absorption decreases, diets become less varied, or we may take diuretics for a long time, all of which can lead to a shortage of these minerals. This is a very common cause. 2. Dehydration, not just about thirst. Young people tend to drink water as soon as they feel thirsty, but in older adults, the sense of thirst diminishes, so many end up drinking very little all day. When the body lacks water, blood becomes thicker, electrolyte balance is disrupted, and muscles are more likely to cramp. Some also avoid drinking in the evening for fear of nighttime urination, but this can unintentionally increase the risk of nighttime cramps. 3. Poor blood circulation, muscles lacking oxygen. Blood is the lifeline for muscles. When blood vessels narrow due to atherosclerosis or vein problems, the blood supply to the muscles decreases, making them tire and cramp more easily. Some people experience what's called intermittent claudication. Walking a short distance causes the calves to tighten, but resting relieves the discomfort. This is a sign of poor circulation and a common cause of prolonged cramps. 4. Medication side effects. Some of the medications we take daily can cause cramps. For example, diuretics deplete potassium and magnesium. Statin drugs for lowering cholesterol sometimes cause muscle pain, and certain blood pressure medicines or sleeping pills can also affect muscles. We may not notice it, but if cramps start after changing medications, it's worth discussing with the doctor. 5. Nerve or musculoskeletal conditions. Diabetes, vitamin B12 deficiency, or spine problems like herniated discs can damage the nerves that control muscles. When the nerve signals are disturbed, muscles can contract unexpectedly. Also, being inactive, sitting for long periods, and not stretching can shorten tendons and muscles, making cramps more frequent. Those are the 5 main causes, and the good news is, in most cases, we can prevent or improve them. And to know when cramps require immediate medical attention, stay tuned for the next part. Part 2. When you should see a doctor immediately. For older adults, muscle cramps are often just a matter of the muscle tightening for a moment and then relaxing. But in some cases, they're like an alarm bell. If you ignore them, you might pay the price with your health or even your life. I want to share with you some red flag signs, so when you see them, you'll know it's time to see a doctor right away without delay. 1. Cramps with swelling, redness, and warmth in the leg. If one of your legs suddenly cramps up, along with swelling, redness, and feeling warmer to the touch than usual, be careful. This could be a sign of deep vein thrombosis, meaning a blood clot is blocking blood flow in a vein. The problem is, if that clot travels to your lungs, it can cause a pulmonary embolism, which is very dangerous. If you have these symptoms, go to the hospital immediately. And remember, don't massage the leg or walk around too much, as that can cause the clot to move. 2. Cramps with numbness or muscle weakness. If a cramp is accompanied by numbness, tingling, or your leg feels weaker and harder to lift, it's likely the nerves are being affected. This could be from a herniated disc, diabetes, or a vitamin B12 deficiency. This is the time to get checked and find out the cause. Don't wait until the leg becomes too weak to act. 3. Pain lasting more than 10 minutes despite massage. Normal cramps usually ease within a few seconds to 1 to 2 minutes. But if you've already massaged and stretched the muscle, and it's still tight and painful after more than 10 minutes, the cause might be related to blood vessels, specifically, the muscle not getting enough oxygen because the artery feeding the leg is narrowed. This should be checked early to avoid complications. 4. Frequent recurring cramps. If cramps occur more than 3 times a week, whether at night or during the day, that's unusual. Such frequent episodes not only cause sleep loss, but also increase the risk of falls due to muscle weakness. At this point, it's wise to get a checkup, including blood tests, electrolyte levels, and a review of your medications. 5. Cramps even during light walking. If your calves tighten painfully after just a short walk, and you have to stop and rest to feel better, this could be peripheral artery disease. This is a blood vessel condition closely linked to heart health and should be evaluated promptly. 6. Cramps with shortness of breath or chest pain. This is an emergency. If you're having cramps and suddenly feel short of breath, chest tightness, or dizziness, call emergency services right away. Don't try to wait it out or handle it at home. Friends, most cramps are harmless, but if even one of the above warning signs appears, don't hesitate. Seeing a doctor early not only gives you peace of mind, but sometimes it can save your life. Listen to your body and don't ignore the signals it's sending you. Part 3. When you don't need to see a doctor yet, but should still pay attention. Not every muscle cramp means you need to rush to the doctor. Many cases are harmless and can be managed simply by keeping an eye on things and adjusting your daily habits. But harmless doesn't mean ignoring it altogether. Here are situations where you can take care of yourself at home, but should still stay alert. 1. Occasional cramps, mostly at night. If you only get cramps once every few weeks, especially while sleeping, chances are it's because the muscles stayed in one position for too long or the room was a bit too cold. In this case, simply stretching before bed, keeping your legs warm, and drinking enough water can make a big difference. 2. No swelling, redness, or warmth in the leg. If it's just a cramp without other symptoms like swelling, redness, warmth, or numbness/weakness, it's usually not a concern. You can monitor it for a few more weeks to see if the frequency or intensity changes. 3. Minimal impact on daily activities. If after the cramp you can still walk, carry on with your routine, and it doesn't cause ongoing sleeplessness or fatigue, you probably don't need to see a doctor immediately. But it's a good idea to jot down when and under what circumstances the cramps happen to help identify the cause. 4. A clear trigger is identified. For example, if you exercised more than usual, pushed yourself too hard during a workout, or sat for too long without changing position, the cramp was likely caused by muscle overuse or temporary reduced blood flow. Resting and gentle massage usually take care of it. In short, if the cramps are mild, happen only occasionally, come without other concerning symptoms, and you can pinpoint a clear cause, you don't need to rush to the doctor. But if the frequency increases, the pain becomes more severe, or any of the red flag signs from the previous section appear, don't delay. Get checked at the hospital right away. *QC, cramps in older adults aren't always dangerous, but they're not something to be complacent about either. Once we understand the causes, know which are normal signs and which are red flags, we're already doing a lot to protect our legs and our health. The most important thing is, listen to your body every day. A pain, a small change, sometimes it's the body's way of saying, please take better care of me. If you found today's tips helpful, please give this video a like so I know I'm on the right track. And don't forget to subscribe and turn on notifications so you won't miss